Hi everyone, welcome back to the Oral Cancer Prevention Project. This is Nhi. I'll be your host for today's episode. So, a little recap on the previous episode. We had a discussions about what oral cancer is, as well as its prevalence, the mortality rate, and survival rate. So on today's episode, we're gonna discuss the causes of oral cancer and what factors can increase the likelihood of developing the disease. Prevention is better than cure, so you can try your best to eliminate any risk factors in your daily routine that may cause oral cancer. So talking about the factors that can increase the potential of developing oral cancer. Oral cancer occurs when cancerous cells develop while the DNA of healthy cell tissues turns abnormal and damages the surrounding cells. First, I'm going to explain what risk factors are. A risk factor is something that increases the risk of developing cancer. Most of the time, cancer are the result of many risk factors. In this case, tobacco and alcohol are the main risk factors of oral cancer. As for tobacco, oral cancer are mostly linked to tobacco or any other forms of it, and that's including chewing tobacco. Some of the chemicals that contain in tobacco smokes are carcinogenic, which means that they can cause genetic changes in the mouth cavity and eventually leading to developing oral cancer. So to put this in an easier way, tobacco and cigarette smokes contain poisons that can weaken the body's immune system, making it a more difficult job to kill cancer cells. The longer and the more you take tobacco, the greater the risk you have to take. Okay, moving on to alcohol. If using tobacco can increase the risk of developing cancer, using both alcohol and tobacco together can increase that risk even more, as alcohol enhances the penetration of tobacco-associated carcinogens across the oral mucosa. But for alcohol alone, there is the reason why it is a risk factor. It is because that it can increase the levels of some hormones in our bodies, such as estrogen and insulin. As you all may know, hormones act like chemical messengers. So therefore, the higher the estrogen and insulin, the more often the cell will divide, which increases the likelihood of developing oral cancer. So another reason is the acetaldehyde in alcohol is toxic and can cause permanent DNA damage, leading to cancer. So, if your parents or any other of your relatives around you that you care about have the habit of drinking alcohol, maybe go talk to them, encourage them to quit it, and of course you yourself shouldn't use any of this too. I believe it is widely known that excessive sun exposure can increase the chance of getting skin cancer. And since the lips are the part of your face, excessive sunlight can enhance the risk of developing lip cancer too. Because of the ultraviolet rays, also as known as UV, can potentially damage the DNA in the cells of your skin and of course, your lips. According to the Canadian Cancer Society, fair-skinned people and people who continuously work in the sun for a long period of time are those who are more likely to developing lip cancer. So to eliminate that risk, you can go to the drugstore and find yourself that any lip balm that has SPF to protect your lips from the sun. So moving on to the human papillomavirus, also as known as HPV. So to briefly explain, HPV is a group of over 100 different types of related viruses. HPV spread through sexual contact, including oral sex. So not only can it affect sexual organ, but it can also affect the mouth and the throat too. Apparently, there are a numbers of HPV types, while HPV 16 and HPV 18 increases the risk of oral cancer. And that's the four of the many risk factors and environmental factors that can increase the likelihood of developing oral cancer. I'm going to list out some more of them so you guys can try your best to stay away from them, like not eating enough vegetable, drinking hot beverages, and poor fitting dentures are also possible risk factors. I want to discuss a little bit about genetics. Having a family member of oral cancer or squamous cell carcinoma, also as known as SCC. As SCC is the most common type of oral cancer, being a first-degree family members like parents, siblings, or child can heighten the risk of developing SCC in the head and the neck regions, and that includes the mouth. Nevertheless, it is important to note that 25% of the people who develop oral cancer don't smoke or have other known risk factors. That is it for today's episode of Risk Factors and Causes. Thank you all for tagging along. I truly hope these informations are helpful to you. Don't forget to hit subscribe to our channel and follow us on social medias for more episodes like this one. Goodbye and have a good day.